Doing a nerve glide or focusing on treatment in this area can be really powerful for our ankle mobility, as well as any posterior lateral corner knee pain, sometimes even anterior knee pain, just general mobility and function of the low leg. The sciatic nerve is one of the big nerves in the back of your leg. It's actually two nerves in one sheath or container, the tibial nerve and the common peroneal nerve. Lower down in the thigh, those nerves come out of the sheath and split apart. Tibial nerve stays pretty midline, and the common peroneal nerve comes off to the side. It splits from the backside here, comes to the side, and wraps around and through top of your lower leg where your fibula and tibia articulate, make the proximal tib-fib joint. Then the nerves come down, one comes more front side and one stays side. As it comes down, it innervates your foot and ankle. So when this nerve is not gliding or sliding well, it's going to affect all the things that it innervates. So the things that the common peroneal nerve or superficial and deep peroneal nerves innervate are that tib-fib joint, both proximal and distal, the lateral compartment muscles, anterior compartment muscles, the talocrural joint, which is our main ankle joint, and then parts of our midfoot and forefoot. So to do this, you're gonna be seated, ideally that your hips are higher up, so we're not challenged by any hamstring length issues. So I like to do it seated in a chair. You can do it seated on the floor, just beware of your posture. So what you're going to do, the leg we're going to do the nerve glide on is going to be straight. Here you're going to hinge forward at your hips, and then you're going to rotate towards that down leg. Keep your knee straight to start. You're going to point the toe and then invert the foot. So like you're rolling your ankles. So it's inversion, toe point, and toe curl. You might already feel a stretch along this side of your leg or even the front of your foot. We want to keep the intensity of the stretch feeling about a 3 out of 10 or less, right? So if doing this with your foot and ankle already give you quite an intense stretch, you can come out of the rotation or back off of a little bit of the hip flexion. So hip flexion, internal rotation of the leg, rotation of the body, straight knee, point the toe, invert the ankle. Once you feel that little bit of tension or stretch, then you're going to floss at the knee, bending and straightening. You can choose any part really along the chain to do the flossing, but the knee is pretty simple to do. After about 6 or 8 of those, you're going to come out of it and then recheck whatever range of motion or shrink test that is of concern to you and see what changed.